Hey, everybody. Welcome to another Conversations in Cases. And we have a special guest here today in our conversation piece, and actually even in the cases part of the Conversations in Cases as well. Jody Camille is our new massage therapist here at OPT2LIV, and we're so grateful to have you on board. So we're going to get to introduce you here as well. And then, Amy, if you want to share a little bit, what's this case about that you're going to talk about later?
So she is a, I don't know, do you call it certified
licensed now?
Licensed
Indiana,
therapeutic
in
massage.
Indiana, that's
Interestingly,
awesome.
Nice.
Indiana used to be certified, but we just this past year now we're licensed.
Awesome. Okay.
Which means really
Therapeutic
that was
massage
for
therapist.
insurance purposes, right?
Yeah, it means like in other states it was the same thing. It just Indiana used a different word.
We
but
never
now
yet,
it's
but now
official.
you're
Bill and
official.
insurance, which is
That's good.
huge.
That is actually a big
So
step. That's
It
awesome.
is, yeah, Indiana's progressing.
Well, because as we're going to talk about in my case, we know that there are therapeutic benefits, and we use it in medicine all the time. I pulled this up off the Mayo Clinic, but Mayo Clinic, NIH, Cleveland Clinic. I mean, there are so many different papers and things where people, they talk about the certified medical benefits, right? So I was just going to start off to list a few of these conditions that they mentioned that massage has been shown to help with: anxiety, depression, digestive disorders, fibromyalgia. I'm sure you've seen people for all these: headache, insomnia, nerve pain, post-op care, scar tissue, soft tissue strains and injuries, sports injuries, TMJ, which is the temporal mandibular joint disorders. They've shown that it improves circulation, decreases muscle stiffness, joint inflammation, better quality of sleep, quicker recovery between workouts, improved flexibility, less pain and soreness, and strengthened immune response.
That's it?
Lower stress levels, improve relaxation,
That's a few
mood,
things.
more energy, increased feelings of wellness. So, I mean, I think if you've never had a massage, you need to. We grew up with this, so we
I
were
know,
so
right?
fortunate
Mom
with
was
your
doing
mom.
It. I think we were teenagers, and so we've been exposed to it forever. And of course, in high school, which is when she started, anytime we'd go to a sporting event, right? Mom was there doing sports massage afterwards,
Oh,
or
really? She
if someone
would.
had an injury, you know, and all that stuff.
that's
So
awesome.
when we started our wellness center in '07, which was Mom and Amy and I kind of doing that together, Mom's like, we're doing massage and yoga in our wellness center. And so it's been a part of a recognized modality of care for us for a long time. But let's get back to you. So we're excited to have you here because you take massage to the massage therapy modality, and then you even do more than that. So what got you into massage? What was your passion?
It's interesting. I always had this as soon as I learned what it was, and I don't know what my earliest memory was. Maybe it was Phoebe on Friends. She was a massage therapist.
Oh, that's right.
I don't really know because I didn't.
That's
have
a lot of episodes.
I didn't really grow up. I didn't
That's
really
so
grow
funny.
up with it in my life. Like I had never even
Right.
received a massage until I think during my first pregnancy, so when I was like 25. But even prior to that, I think learning about it, it was always like, ooh, massage therapy. Like that's something I think I could really get into.
Yeah.
So it was like this weird kind of intuitive like draw.
A
Like I'll
knowing. You
pursue that
knew.
eventually,
Yes.
and I know that I'll like to do that. And then had kids and. Didn't
that's
do
not
it.
distracting.
And then, yeah, it was a little busy. And then it was actually funny.
Maybe not about me anymore.
Either
Let's
it was
focus on these.
always massage therapist or yoga instructor. Actually, were my two like one day.
Oh, wow.
And we'll see about yoga one day also. But
Over here.
and so I needed a career change and looked into it, and it's everything I
perfect. Yeah, it was
thought.
supposed to
Just
happen.
came on at the right
Yeah.
time, and it's I'm just really passionate about just the importance of touch in your life
Mm-hmm.
and intentional sacred touch, because you can get all different kinds of massages and you can go through the motions and do the different techniques and there not be anything like intention behind it. You can and you
Right.
can get good benefits from a massage just going through the techniques and without intention behind it necessarily, if they do what they're trained in the certain things. But to me, it's always been something more like But this is
Sounds like you're talking Reiki stuff now.
Well, to me, that's a whole other thing too. So yes, I like to incorporate energy work because we're doing it anyway. We're all energy. We're all interacting with our energy. Again, intentionality.
Know it or not, it's
and and sound is so powerful. So I've been slowly incorporating more sound into it, hoping to use tuning forks, which are found to be.
I've heard you doing the singing bowls.
The singing bowl, yeah.
In a session.
Yeah.
Well, yeah, you went.
Yeah,
you
it
had
was
a session.
amazing.
Amy
Sound
did
frequency, yeah.
You stole
and
me
Kim
one.
does that a lot here. Yes, I do. You'll get one. But yeah, so me, it was always just passionate about making people feel safe, comfortable, heard, and then just making them feel better. Of course, that's just
Well,
like
that
that's just
always
the bonus
happens.
of they leave
Yeah,
feeling better.
yeah.
And like you said,
What did you do to me?
all of the different
I am a
things.
different person now.
Yeah, we get a lot of that. All the different things that it benefits. It is just a really powerful modality. And to even, like I said, touch alone reduces your cortisol levels. And if you're
Yes.
reducing your stress, I mean, you're going to improve your immune system.
Live longer.
Like, yeah.
All
so
that stuff.
Just that alone is so powerful. Just touch it within itself is like,
Isn't that amazing?
Yeah,
I
so-
never even thought of it that way. It's so true.
yeah.
So massage is obviously your professional endeavor. But personally, I mean, you have 3 kids, right?
Yes. I have a couple of teenagers, well, almost teenager, and then a little 6-year-old, and
It's a little bit of energy.
That's which is interesting, trying to teach them about the importance of it and give them little massages, and some
Right.
are more open to it than others. Which you grew up with this.
Oh,
I
I
don't know how
know. We
open you were
always
to it as a
acted
kid.
like we didn't. I always acted like I was like, this is ridiculous, but I always loved it. Right? I mean, it's just, what is that about? Who knows?
Yeah,
But you know they love it.
Yeah, Benji will ask for little massages
Aw.
at night,
Mom.
and even Reiki, he's understanding like that it's powerful, and I tell him like you can do it too, and
Right.
so
Yeah.
all of that.
So you're Reiki certified.
Yes, that's a certification. Yeah.
Yes,
And Reiki 3, so that's the master level, not teacher but master.
So we should call you
Wow.
Master Jody.
no, you should know. Jody's
Well, for
good.
those that don't know what Reiki is, maybe you can
Oh,
tell
yeah.
a little bit about what Reiki is. We've
I mean,
talked
this
a little.
stuff, this is kind of my jam anyway.
Oh,
Of course,
yeah.
I've always done energy work,
Mm-hmm.
but just because of Mom, kind of introduced it. We didn't call it Reiki
Mm-hmm.
back then. But, working with the energy of healing, and even myself at 10 years old, using it as a way
Yeah,
to
you
heal
told me that story.
myself. And that's when I was like, oh, there's something here that is real and, something I should continue to explore. Right. And so you can do it for yourself or you can share it. Right.
Yeah.
And this is where the Reiki has multiple layers. Right. Number 1 is self, and then 2 is others, and then 3 is teaching.
Yeah,
others.
and it's Reiki is meant to be a self-healing
Yeah.
modality. So it's as a practitioner, you're facilitating self-healing. So it's just we all have the power within us to heal ourselves. Our bodies are designed to heal themselves, and so it's using energy intentionally, sending whatever people have intentions that they want you to focus on, and send like that kind of energetic intention. Or if they have specific areas of their body that are hurting, you can be intentional about directing energy there. And then, so basically it's just a reminder to them of their own healing power.
Yeah.
And I don't know, people have really interesting results with Reiki, and you don't necessarily notice or feel like these magical tingly feelings. Some people have like all kinds of wild experiences and visions, and like they feel all kinds of things throughout their body, which is awesome. But if nothing else, you will be like in the deepest state of relaxation that you can get in, because it's
That's so beneficial.
Yeah, you're just laying in silence while someone is gently placing their hands on you. And with Reiki, you can do it with or without touch. You don't have to directly touch someone, but
Now, in massage therapy, you get
there's
both.
a lot of touch. Yeah, you get both, and
Right.
it's a lot of touch in massage therapy for sure. But what was I going to say?
Well, and I love that about the energy because, I'm fascinated. I'm a mechanical engineer. I'm fascinated with physics. And, the more and more I study it, the quantum physics stuff, which is so cool, we're finite physical beings, but that's only 4% of the energy in the universe. So we're actually more infinite, energy-based beings, 96%. So when we talk about this energy stuff or Reiki, and if it's like, I don't know what Reiki is, just know that would be more of who you really are, right? And less of this stuff. So it's just
that's a good
tuning
way to think of
into,
it.
naturally really what we are as instruments of God's making, which is super, super cool. I think, so yeah, let's talk a little bit about a session. What do people usually get? You have a 75, which is a little different. A lot of times people are like, 60-minute, which means you get 50 or 45 minutes of massage. And so you had some good ideas there. There's a 2-hour massage. So maybe just explain these services.
Yes. So for me, working in a spa and doing that kind of conveyor belt massage, and you don't have a lot of time to really just talk to your client because you have to just keep them in and out,
Right.
and that doesn't really align with me. But
Good.
I mean, it's great to have when you need it.
Yeah.
But so when doing my own thing, and I was thinking like 1-hour massage, but then really I was like, how would I really want to do it? What is like my ideal situation? Because I can do however I want, and so 75 minutes is, I think it's great for the client, but honestly, 75 minutes is great for me to know that I don't have to rush through. Because
Is this Einstein time?
We'll talk about that in another one. To get through someone's whole body, full body massage, front and back, head to toe, and knowing how much time you have, it's a lot to fit in. So I was just, why not give myself more time? And they get more time, and you just feel like you can really like sink in and relax and not just be thinking like, oh, is time almost up? I mean, we've all had massages and you're like, oh, I wonder how much time is left. I hope it's not ending soon.
It was I had never had anything but a 60-minute massage. So when I did the 75-minute, you're absolutely right. Because I'd always be like, it's over, or I didn't have enough time on my neck or whatever.
Yeah.
And it was amazing.
Yeah.
So you did well. That was a good
that's,
idea.
That's why I was hoping to just give us all more time to like fully be intentional about every part of their body.
Well, even the intake, you were like, I need to understand the client, learn a little bit about maybe what are their needs based off of your questions that you have. What are they looking for? And then you, as a professional, also like, this is what I think you need too, right? So then you incorporate both, which is super cool.
Yeah, for sure. Yeah, I always want everyone to feel heard and then have the time to do what they needed done.
I know, I struggle. I don't feel like people hear me a lot of times. You know?
Speak up, Eric.
Yeah, okay. Not as a joke. Yeah.
But sometimes you when you only have so much time to ask them questions, but knowing that I have just plenty of time to ask questions. And I'm actually working on like a more like kind of in-depth like intake questionnaire of what I think are just really the key things to know going into it, like how people are, how you use your body every day. I mean, and what types of, like, are you lifting things? Are you sitting all day? And a lot of people are sitting all day. Unfortunately, it's probably the number one.
Yeah, that functional intake is helpful, I think, right? Because a lot of times people are doing things repetitively.
Yeah.
And then you're like, oh, okay, sitting all day. That psoas muscle's short.
Yeah.
Right? And blah, 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 blah. So you go through all that stuff. Now, talk to us about, so if you're in a massage session with you, you might hear a singing bowl. What else do you incorporate? Well, or just, I couldn't remember if you were doing, I know you have
can
crystals.
hear Puccini's next door.
Yeah, so if anyone's like, what's
may
that
have
sound?
Sorry,
We're
guys.
next to Puccini's and they're making pizza.
We have no
so we're doing this in the
control
morning.
over there.
Think of it as white
Preparation
noise.
for their food kitchen.
Different
They're
style of white
actually,
noise. It's not so bad.
I've gone over and say, hey, what is that noise? And it's they make the pizza dough and then they put it in a machine and it actually spreads it out into a pizza dough.
Oh my gosh. So that's what we're
and then
doing,
they've
right?
also
Right,
got
right.
a can opener that is, those big, and they,
Yeah,
I think that's that sound there.
Pizza place and use one of those.
For the pizza sauce. Anyway, so you're going to get maybe sound healing.
yeah.
I couldn't remember if
Cupping.
there was, the cupping.
Cupping.
Yes.
Yeah, I'm really
Yes.
passionate about cupping. And if you don't know what cupping is, it's using suction, and there are different styles of cups. The stationary, like Kangzu, which I mean, we get really into cupping. Or there's the dynamic cups, which you can move while they're suctioned on. And there's also fire cupping, which I don't offer that in currently, but I could do it. That's
Hawaii,
more of like a novelty cool
spinning
thing. But
fires.
cupping.
that would be, because that's kind of the
Exciting.
traditional way. I mean, before plastic and silicone, it was could use like tubes of bamboo, like all different kinds of things traditionally were used, and then you use the heat so that it removes the oxygen and then creates the suction. So if you put heat in a glass jar and put it on, and then it's the same idea. So that's really cool.
That is cool.
But so basically, cupping, it pulls the fascia away from the muscle, and it allows any like stagnant old blood toxins that have built up in an injured muscle, whether it's just from a repetitive use of a muscle or if there is an actual injury or a muscle knot. So stuff can't circulate through that when there's buildup in the tissue. So cupping allows space for it to be flushed out, and then new blood with nutrients can get into the area, which creates faster healing. And it also just kind of loosens everything up in general. And some people's fascia is just really tight for whatever reason. A lot of times it has to do with hydration. But if their fascia is really tight, then you spend a lot of time trying to get through it to the muscle, to get deep into the muscle. So cupping allows you to just loosen that up faster and then get into the muscle. And it's kind of like a deep tissue technique without the pressure, because sometimes people can't stand the pressure on a painful area. So the cupping allows like a different way to work on the muscle, and it leaves those infamous marks on your body, or can or can't, depending. Especially if you leave them still, and they're not bruises. They're literally like what was flushed out of the muscle.
Probably,
So
it comes to the surface, and
interesting.
which is why you need to drink plenty of water after, so that you can
flush it out,
flush it all
detox
out of
it,
your system.
get it out of the body.
Otherwise, you'll just reabsorb
If
it.
you're like, what is fascia? So when you start as an embryo, you're 100% fascia. And then little muscles grow inside that. And so every muscle fiber has fat fascia around it, right? And then there's bundles of fibers, and that has fascia around it. And then there's bigger, and then that has fascia around it. We're mostly fascia.
When you look at like a piece of
muscle
chicken,
within
that's a good way to see it, like that really thin layer that's kind of laying over when people look at like raw chicken. I know that's gross,
Right.
but that
Not
is
the skin,
that's
but
an
deeper in.
example
Visual.
under the
Yeah.
skin, but then you can see that like really thin layer that's over it. That's that's it.
So we got the
Lots of fascia.
cupping, and then
I also offer instrument scraping techniques, which I have some scraping tools and some gua sha tools. But I just, again, use them as needed. Not everyone will necessarily benefit from using different modalities.
so it's dependent,
Yeah, and that scraping on the feet, that's something I'm really into right now,
Yes.
just because people who love foot massage really love foot massage. And scraping is just the new way to get into all of the little curves of the feet.
And I had
beauty of
never
the-
had
all
that
the
either.
crunchy
It
things
was
in your feet.
Yes.
You used to make me rub your feet.
There are a lot
Back
of
in high
pressure
school.
points, right, on your feet
Yeah,
and stuff too.
reflexology.
But like you said, who sits there and rubs their feet, or who just the tightness that our poor feet. Do we stretch our feet? You know,
Right. They do make a lot of great like self massage, like foot massagers. If you see those little rolly things, or they even have
Oh,
like
that's right.
they even have reflexology mats that you can walk across that have like they almost look like fake stones kind of, and you just walk across them. Or you could walk in like a gravel driveway and get the same effect, but and not buy the
that
fancy
ow,
mat.
hurts me.
But
I
but yeah,
know.
if you look at a reflexology map, which there's one for your hands, your ears, and your feet. Feet is the most common way that we use reflexology. But if you look at the map of it, and it shows, and if you've ever seen one, like it shows every part of the foot and like what organ
Yeah, I know.
it's
It's so
linked
cool.
to in your body. And so yeah, you can do so much just with
Yep.
your thumbs and someone's feet.
so amazing.
Yeah.
It's so amazing.
It is amazing.
So
thought
yeah,
it
so
was
we're
amazing.
super excited to have you on board. I mean, it's
Super excited to be here.
If you are interested in booking a massage, you can go to OPT2LIV.com, click on the massage button, and then you'll see all the services, all the times available, and all that stuff. So we definitely would recommend people jumping in there. Is there anything else we should share about you?
About me?
Yeah, I mean, Professionally,
know.
personally, whatever.
I don't know. If we're going to talk about kind of like who, like not that, well, you had said ideal client earlier, but I think everyone's an ideal client for massage. But I was going to say the different lists that you had said, like headaches, the things that people don't think about massage for. Like people either think, oh, that you just go and relax, or you only go there if your back hurts or something. But it's really great. Well, it's great maintenance to keep something from getting really, like, especially things that we overuse, is to keep it from an injury. If you do have an injury, like you said, to work on the, what's the word I'm trying to say? From an injury. The
recovery or no?
The working on the tissues. I guess
Scar tissue.
Scar tissue. I was like, what's the word?
Look at me.
Thank you. We were just talking about it.
participated.
That was a quiz.
Yes.
No, that is true. The
Scar
scar
tissue.
tissue. I think that's what
People
my
don't-
case patient had.
People
maybe.
don't realize after an injury,
Yeah.
you're going. Some people form way more scar tissue than others. Just depends on your own body, but just letting something heal after an injury without really getting in and treating the scar tissue, you just lose. I mean, if it's on a joint, you lose mobility. So much mobility because scar tissue is so tight, and after a while it's much harder to
Right.
work through the scar tissue.
Right.
So that's something important to do as a preventative measure after injury. But headaches, I feel people underestimate how powerful massage is for headaches, and I think it's because people think that they have migraines. Everyone thinks they have a migraine.
They're holding
And
tension
some
in their
do
body.
have migraines.
Well,
but I've had so many clients that have gone to so many doctors, had so many tests done for their headaches, had their brains scanned, all
They're
these
on
different things.
pharmaceuticals,
And all they're
probably
ever
don't need
given
to
is
be.
pharmaceuticals. And then I
Yeah.
feel their neck, and there's just so, like the infamous
knotted
tech
up.
neck tension that we all have
Uh-huh.
at the base of our skull, your occipitals here. And what do
That's-
you know? You give them a good neck
awesome.
massage, and
Yeah.
like I have multiple clients who are like, I don't get headaches anymore, or like,
That's wonderful.
but because so they're misdiagnosed, like they're having
Right.
tension headaches. Tension headaches we can treat through massage. Migraine is a totally different thing with your
Right.
brain. But most people have tension headaches that they're not
agree.
realizing and are going undiagnosed, and they're giving pharmaceuticals, and no one ever touches their neck.
Right. We're
That's
excited
so
about all these
amazing.
modalities and how that integrates into the care of people because,
Mm-hmm.
I mean, one of our vision here in OPT2LIV Medical is to even help heal the healthcare system because they're slowly starting to recognize these things. And as they do, and as we keep proving that all this stuff really, really works, we see a future where, our healthcare system recognizes these modalities as standard. I mean, this, you would get I'm going to write a prescription for a massage before we start your pharmaceuticals.
And you know
Yeah.
what? It is awesome now because the way with insurance or different things, some people are able to use their HSA, or some
Right.
people are,
Yes.
able to at least get that benefit if they get a prescription from their physician. So I do that. I recommend it or prescribe it. Prescribe it a lot.
Yeah.
Yeah, good.
Yeah, so that's why it was such an important thing to us to have this actually in our space. It's part of our patient care. Just like the 4 pillars are part of our care, we really feel like massage, yoga, having that as part of our office space, just so that people could see this is, like you said, it's part of it is proactively being preventive and, using this as self-care for prevention and lowering stress and all of that, but
Yeah.
also as part of the healing and prescribing. So.
It will definitely lower your stress, and if you lower your stress, I mean, it has endless benefits to what's going on.
Yep. You're going to live
body.
longer. So what's this case?
Well, so the case is a patient who had rotator cuff surgery, and I had experienced this, and the case isn't me. But if anybody's ever had an injury, you know that. So you injure it, and then you start using other parts of your body more because, like I injured my left one, so then my
And you
right
strain,
side started
yeah.
getting sore, and then you hold it funny, and then you go have surgery, and then you're in post-op, sleeping in a recliner, and and then the scar tissue and all that and the healing. And so this patient was months beyond and was still trying to heal, and just really unrealistic pain for the post-op period. But the surgeon was like, your surgery's beautiful. Everything's fine. I think it's just healing still. And I had gone through this myself, and I'd gotten a lot of my mobility back, but I always thought, well, you just are always going to have pain and decreased mobility after a surgery until I started going more consistently to massage. And then I was like, oh my gosh, it like released something. And then that my range of motion had improved, and my just that chronic pain that
And
I
you were
just,
nicer
it
to
was
me.
a
I mean,
dull
it
pain
was amazing.
that was there, and I slept better. And so I prescribed this to this patient. And because her pain was so bad, like I had to put her on gabapentin. And I mean, it was just really, she was miserable and she wasn't sleeping. It was
Sounds
impacting
intense.
her
Yeah.
work,
Quality of
and
life
it was just really bad. So anyway, I just saw her recently, and she's been doing consistent massage. She's off her gabapentin. She's just, I mean, amazing. Like her shoulders, just like she's not thinking about it all the time. And so I would like you to help. I know, like we mentioned the scar tissue, but also like when there is an injury or like a muscle, or like even like I had a partial hamstring tear and used massage to help heal that. Isn't it like the muscle fibers, when they're torn, doesn't massage help like kind of realign those fibers so that the healing of that muscle, you might be able to speak in a better manner than me on that, but with injuries, like what happens specifically?
It definitely can, help with the reforming, because if you think about it, when you have an injury and then you're probably going to be using that less because you're thinking, oh, my shoulder hurts, and so I better not do this because it hurts a little. But really, so then when it's rehealing, your muscle fibers are then, going back in this stationary state where it's a joint where it needs to be loose and moving and be able to stretch. So if you're actively like working on breaking up scar tissue and doing like different deep tissue techniques, then you're going to like keep lengthening the tissues that are trying to form back together nice and tight. And because I mean they were just hurt and they're trying to reform a tight connection. But so it's going to be really tight if you just if you leave it alone. So actively treating your scar tissue will just let you keep as much range of motion as you can, because you're going to be continually lengthening it as it's healing. And so and just keep your rather than it just
muscles,
because it comes tight and hard, and then that's your new muscle unless you're going to work on it to loosen it up. So and I feel like
catching it sooner is better than later, because
Yeah.
if you're trying to do it later, that hurts.
Yeah, that hurts. It's very formed and doesn't want to give in to change.
It's a love-hate
But
thing.
it definitely should be something that's prescribed. And people go to PT after injuries and they'll do some stuff for it. But really getting like a deep tissue, like scar tissue treatment is like so essential. I mean, especially like a joint injury, it is like absolutely necessary. But really anywhere you can lose your flexors or your flexors and extenders, you can lose like mobility there as well. So any kind of muscle injury could benefit from scar tissue treatment, because
that's awesome. I mean, I just have case after case where I have recommended that to patients, and we did a study on chronic low back pain.
Unbelievable results.
Years
yeah.
ago,
I mean,
when we used
it always
massage.
works. Yes.
What else? So we did. It was massage, and we educated on like hydration and diet.
Yeah.
But it was just basically on that, and we did some breathing techniques, like we kind of our pillars, really.
Right. And then we went on and did a meditation with it as well. But every time you do any
But
of these things,
these were people who had
in this
numerous
vein,
back
you always see-
surgeries. They were on chronic pain medications,
people
and
come
to
in
see
wheelchairs. And
I
then
mean,
after, I think it was 3 weeks, they were walking in, and then at the end, they're hugging
So
me.
literal
saying this-
miracles happening.
That's good stuff.
yes,
Yeah, it
literally.
Before your
works.
eyes.
So I think it is just realizing like so many therapeutic benefits that we've talked about, and so you're right. Every patient, everybody's an ideal patient.
Everyone is an ideal patient or client. I think so. I mean, everyone could use more just loving, calming touch. Everyone needs like decreased stress levels. Everyone needs that.
Right.
And so if nothing else, if you're not in any pain, you would benefit in like so many important ways. So
Yes.
I'm very pro massage. So.
Yes.
Yeah, and
We're all
as are
biased
we.
a little
Yeah.
bit here. But if you look at our culture, the stress here isn't going away. Now, if you live on an island, then you probably don't have to worry about it.
In a bubble.
Well, you could
With no
probably still
outside
use a
stressors.
massage.
Yeah, you could still use a massage.
Sounds like a lot of hard work.
Well, it was great meeting you, and we're grateful to have you. You can
I'm
go to
so grateful to be
optolive.com,
here.
hit the massage button, schedule. If you have any questions, you can always call us at the office. And if you have any other questions, always subscribe or always hit the like button, share it, all that stuff.